My name is Dr. Neela Sandel. I'm an MD who focuses on functional and integrative medicine, which is to say that we look at the individual and solve root cause problems. We help a lot of patients with mold toxicity, environmental health issues, genetic precision, and figuring out how do we fix their unique problems, whether that's a matter of getting the precise biochemistry corrected for them or helping them fix their home environment. What do we need? How do we solve their problem? The most common question we get is, "Doc, I just came back from Cleveland Clinic or Mayo and no one can figure it out." That's us. I got into the business of integrative medicine by wanting to get great results in medicine. When I was going through medical school and residency training, it became really clear that for some reason the conventional mainstream medical system doesn't know how to treat certain people. And mainstream medicine wants to just do the thing. They want to call it in. They want to say, hey, this is how we do this. If they don't know how to do that, they send it off on a referral. That's not what we do. We are elite problem solvers. Someone comes in, they're our project. We are going to be the physician scientist that works with them to figure out what is actually at the root of that. That's how I got into that, just trying to get better results for people. Indoor air quality is a really commonly missed element of healthcare settings. If you've got a healthcare setting, you've got people of all different stratifications of health. Some of them are hopefully quite well already, but some of them are really challenged. And one of those challenges can be air quality. We're talking about mold, we're talking about bacteria, we're talking about toxins, and healthcare providers need to start to pay attention to their sensitive patients. It's not all your patients who need that attention to indoor air quality, but I guarantee you there are some of your patients that definitely do need that and will have better outcomes. So if you smell any sort of must or odor in your healthcare setting, honestly, you're doing a disservice to your patients. You need to get that addressed. I like that Pure Maintenance is easy to work with. There's a lot of options for mold remediation and indoor air quality, and most of them are hugely painful. You're talking about demolition, you're talking about reconstruction, and then even if you do that, you haven't gotten the entire area. Let's say you have an area of water-damaged drywall. Sure, you can remove that, you can rebuild that, but where else have the spores gone? Are there other areas that you didn't realize? And then you're stuck just redoing that again in a little while when you smell some must again. So I think of Pure Maintenance as very thorough, as well as easy to use, which is just a heck of a combo. So when I recommend Pure Maintenance for my patients, what I'm looking for is I'm looking for perfect results, something that is cost effective, and something that doesn't drive them crazy with logistics. I've had patients in the past work with other mold remediation projects, and honestly, the demolition and the remodeling and all of that makes that very, very exhausting for clients. And these clients, these patients are usually already not feeling great, and so I want the process to be as smooth as possible. I want them to be as confident as possible that after they go through the nuisance and the expense, the job is going to be done right. And I found that Pure Maintenance has always treated my patients right.